me, it means everything to be a safety coach. I know that I'm making a difference and doing the right thing. If I can make one tiny little catch that makes a difference, I'm all for it. It's very easy to break a sterile field. All you have to do is merely touch something that is not sterile. Your face, your cell phone. We were in the middle of a PICC procedure and our patient, who was intubated, needed to be suctioned, and the floor nurse was nearby texting on a phone. And when she heard the patient needed to be suctioned, she slipped her phone in her pocket and came right over to the patient without changing her gloves. And that's when I stopped her and reminded her that she needed to change her gloves before doing patient care. It doesn't really matter what your title is. It's what's best for the patient, no matter who you are. We're all in it for the patient, doing whatever needs to be done to reach the same goal, no matter if we're a doctor, a nurse, or a PCA. So I always feel confident and supported enough to raise concerns.
One of the things that's fascinating about the Safety Coach program is it really emphasizes the fact that safety is a team sport. No matter what my role is at Cincinnati Children's, I can coach one of my peers, and my peer doesn't have to necessarily be somebody with the exact same title. They can be the chief of whatever, and I can feel that it's appropriate for me to coach that person. That's exactly what we need from our safety coaches.
I think the most important thing to remember about safety coaching is that we continue to have safety coaches focus on 5-to-1 positive to negative feedback, and that we continue to remember that they are not policy police, they're not auditors, and they're not disciplinarians. They are frontline staff who are committed to championing safety each and every day.
I was going into the cafeteria one evening to eat my lunch, and I just picked up a fork and I went to sit down. Normally just run the fork through the side of the sleeve and you can get it out, but I tried to physically just tear the top of the sleeve off. And I noticed I couldn't tear it. I started stretching it out and stretching it, and eventually it got to be 18, 20 inches long. And I was horrified knowing that our homicidal and suicidal patients may get possibly 3 to 5 of these a day. Here at Cincinnati Children's, my supervisors and managers listen. Every time I've turned in something that was significant, that was safety related, it's always been followed up, it's always been corrected or remedied. I feel very comfortable reporting anything to them, knowing it's going to be followed up. They've taken all of the plastic sleeves out of the patient care areas. It is just individual forks and spoons that are distributed, unwrapped to the clients. I possibly prevented, a tragedy in a psychiatric institution.
There are so many things that need to come together for us to really get zero harm. We need to have, of course, great people and great systems and great equipment. But I think what really drives it is our behavior every day. And so I have to say, if we did not have an exquisite safety coach program, I'm not sure we'd be able to deliver on the behaviors, and I think we would not be making the progress we're making towards zero harm.
So I had gone into my patient's room for that night, and the mom had asked if I could recheck the actual order in the computer compared to the monitor for the heart rate settings, because she had said that the previous nurse had set the heart rate limit to 200 as her high, which is extremely high for this patient in general, let alone for anybody. She had questioned that nurse and had been told that no, that was the order. So I did go back into the monitor and change it to what it actually needed to be.
One of our goals here is family-centered care. To encourage the parents upon admission, we tell them you can ask about hand washing, you can, correct somebody if they come in and they don't put gloves on or they don't wash their hands, or if you just see something out of the ordinary. We have a safety coach board where we have a lot of information on it, but the main information on it is the safety catch of the month. We have a fishing boat with a hook that goes down to a bunch of fish, and each fish has a different safety catch that was made. Some of these catches are made by families, some of the catches are made by other nurses, RTs, PCAs. The thing that we're trying to get is transparency on the board so that they know that we recognize that everybody makes mistakes and we are acknowledging our mistakes and hoping that they help us to prevent them from happening. When a parent makes a safety catch, I just want to say thank you.
Having a strong safety coach program doesn't deliver everything. It isn't the only thing we need to be doing, but it's absolutely necessary. We will not have a strong safety culture without a strong safety coach and safety ambassador program.
The best thing about being a safety coach for me is knowing that I am playing my part in making a difference in my patients' lives and their outcome.